listening to the voice recording and viewing the screencast for Project 1 in the BIO1025 Medical Terminology course at the University of Northwestern, St. Paul. Today is February 3rd, 2020, and we are here to learn more about how the word unconscious relates to medical terminology. My name is Christine David, and I will be guiding you through today's mind map. According to the Snappy Words Visual Dictionary, unconscious means lacking awareness and the capacity for sensory perception, as if asleep or dead. In other words, it is a state in which an individual's brain is not able to function at its normal capacity in receiving, processing, and responding to incoming signals. This is the opposite of conscious, which is defined as having awareness of surroundings and sensations and thoughts. This begs the question, what are some instances where an individual is pulled out of consciousness and put into an unconscious state? According to a 2020 article from the Journal of Johns Hopkins Medicine, the primary means by which a person is most likely to lose consciousness is through a traumatic brain injury. The brain can be injured in a variety of ways, from suffering a blow to the head to excessive shaking during the early stages of cognitive development. When a brain injury is very severe, the patient can go into a coma. Marcel Arcand informed readers of the Canadian Family Physician Journal in 2015 that advanced dementia can also lead an individual into developing a coma or becoming comatose. Patients that are comatose appear to be unaware, insensible, or asleep and require intensive care. While doctors and nurses certainly do everything within their capability to take care of patients in this state, there are concerns that unconscious biases can play a role in patient care for the comatose. Dr. Michelle Van Ryn told Mayo Clinic's research program on equity and inclusion in healthcare on April 21, 2015, that, quote, all of us, despite the best of all possible intentions, are affected by unconscious processes. It affects what we see, how we react, how we feel, how we behave. If we're not aware of it and taking measures to counter it, it affects quality of care, unquote. Thus, even though we are not suffering the unconscious effects of a coma right now, our unconscious psyche can still affect our feelings and decisions if we are not careful to keep it under control. Those working in the medical field must constantly be intentional to not let their subconscious biases play into their caregiving. Thank you for listening to today's voice recording and screencast on the medical term unconscious.